Hello, I'm Dr. Bergina, and I'm going to talk you through and walk you through a typical TMS journey. There have been some questions about that, and so I wanted to make sure that I could share this with you. So, the overall process for TMS, the recommendation based on the initial studies, is 36 total treatments. So, I'm going to walk you through week by week, and I just want to thank, shout out to Neurostar because they came up with this little mini journey right here, and I love the way that they did that. So, we've tweaked it, obviously, to make it a little bit more simple and to make sure that it's something that patients can truly understand and appreciate and understand also not just the complexity of what can happen along the way, but the personalization. And that's why there's some complexity. So, first of all, in days 1 through 5 of your actual treatment, you are obviously going to meet your treatment team that very first day, and they're going to do something called mapping, where they're looking at your motor cortex and then they're extrapolating either using a 5 centimeter rule or something called F3 beam method in order to find the area in, for most people, the dorsolateral prefrontal cortex that they're going to mark and that they're going to be tapping into or they're going to be utilizing. That's right here, all right, around that area up here. You're going to meet the team, they're going to do the mapping, and then you're going to establish a routine where you're coming in about the same time every day for about 20 minutes for most people, 5 to 10 to 20 minutes, depending on the protocol. And they're going to introduce you to what the treatment is like in that first week, right? Your first 5 days. Because remember, for TMS, you're coming in 5 days a week for those 36 treatments, roughly. We'll talk more about that at the end. During this time here, if we're having difficulties getting you acclimated, this is where we're doing a lot of adjustment of the device, of the frequency that's used. In some cases, that's how fast the pulse taps, the intensity of the pulse based on your comfort level. So when people are like, oh, TMS was uncomfortable and I couldn't tolerate it, that's a problem. I need you to, preferably in those first couple of days, but definitely by these next period of time, because some people are like, oh, I could tough it out, it's fine. If you're having difficulties with pain or difficulties with any symptoms at all, headache, any of those things, you need to let your treatment team know. Okay, because you're getting used to the treatment, but that doesn't mean that you have to be in pain. There are things that your treatment team should be able to do to help you out. Now, you're trying to maintain whatever routine you've already established, and I'm sure that they've already told you certain things, anything from the way that you wear your hair to whether you're having coffee in the morning or whether you're eating your morning smoothie or not. You want to try to keep your routines as the same as possible, right? Because the TMS is already changing some things, and everybody knows in a good research story, you don't change too many variables at one time. You can stick with one thing, and so you keep your regular routine going. Now, there may be new things that you pick up that are healthier, but your overall, whatever your base routine is, this is not the time to, move or change jobs or those big kinds of things. But if we are talking about healthier goals, like making sure, I'll give you an example, we've decided on a goal, a movement goal. Let's say our goal is that we're trying to get you to the place where you're walking more, right? You're getting a little bit more exercise. Well, then you might have said that over the course of the next 6 weeks, I'm going to get to walking a mile a day, right? You're going to use the American Heart Association's walking chart where you start with 5 minutes and then you can walk all the way up to 30 minutes or an hour, depending, right? That might be a healthy goal that you institute, but we're trying to get that started right at the beginning. You're not necessarily going to notice a huge difference in terms of the way that you feel within these first 10 or so treatments, but between 11 and 25, somewhere in there, you know, definitely you're starting to notice that things are getting better. You're going to continue your treatment, but please be honest with your team. If you're not really noticing any benefit at all, other people might notice, family members, friends might notice around this time. If you're not noticing any benefits at all, then I definitely want you to make sure that you're honest with your team. If there's nothing else on this board that you pay attention to, please pay attention to this one right here. Be honest with your team and let them know if you're struggling, if you're having a hard time. Please continue your goals. Don't just stop. Remember, we want to establish a routine, keep the routine going. What got you here needs to keep you here. And as we round out here, you will start seeing major results between weeks 26 and 30. Days 26 and 30. So that fourth week, you should definitely start noticing some things. And here is where, if you're not noticing as big of a result, in our clinic, we're doing PHQ-9s or BDIs. These are assessments that we're doing as we go along, or GAD-7s, HAM-Ds, HAM-As, something as an assessment depending on what your situation is. If we're not noticing major changes, then we may adjust the treatment. You may notice that your provider says, I want to go from the left to the right, or I want to go from the left frontal to the middle. There's all kinds of reasons why a person may adjust the treatment. But these would be examples of why they would do that, because during this time, if we're not noticing a huge benefit somewhere between this week and this week, we may adjust things a little bit. Again, by this time, by day 30, you should be meeting your initial goals, right? Because we change goals about once a month, which brings us to the last week, which is where I'm going to skip down to the bottom, a new goal. So let's say your goal initially was to walk 30 minutes a day or 30 minutes 3 or 4 times a week, right? Now we might have amped your goal up to say, all right, I've been able to walk 30 minutes 3 or 4 times a week. Now I want to be able to walk 30 minutes every day. Every morning I want to go out for a walk. Okay. So new goal, but it's really more of an adaptation of a regular goal that you already had, right? But it's the new goal for the following month so that you continue to keep growing. You keep adding these beautiful goals. Now let me go back. This last portion of the time, we are beginning your taper. We're going from 5 days a week down usually to about 3 days a week, and then 2 days a week, and then 1 day a week, and then you're stopping your treatment, okay? So those last 6 treatments are a taper. And then you're going to continue whatever routine you have going that has helped get you here. Again, remember, what got you here is going to keep you here. So if you already were started on an antidepressant up here, you're going to continue it. You're not going to just stop at the end. You may taper that off over time, but for us, once a person gets to good treatment level, then we start tapering after that. Remember, we think about depression as cancer of the soul. I would never just stop a person's cancer treatment and then say, bye-bye, see you later, never see you again. No, we're going to taper or stop whatever you were on before, chemo, proton therapy, whatever. We did our surgery and you're in the process of recovery, but then we're going to continue to monitor you after this. You may not be coming in and seeing us in person, but we're still going to monitor you virtually, your provider. Now for our clinic, because we're predominantly an interventional psychiatry clinic, we may not see that person as often as their primary psychiatrist or their primary care doctor, but we're still going to connect with them. We're still going to stay connected with them, right? It's kind of like you don't see your oncologist all the time, but you will see your oncologist every few months or at least once a year, right? Same difference. Okay. I love it when we say that, same difference. It's the same thing. Okay. All right. Dr. Bergina, I hope this was helpful for you. You guys stay healthy, stay well, and have a very blessed day on purpose.